On air 24/7. This is today's News Talk TNT.
Right, now during the break then I was asking my next guest, Liz Evans, had she been on the show? Because I've had so many great guests. And I was actually surprised. I thought she would have been on the show, but apparently we had her arranged to come on last year and it fell through at the last minute for whatever reason. So long overdue. Welcome to the Freeman Report, Dr. Liz Evans.
Thank you. Thanks so much for having me on. I'm really excited to share some great news with you today.
Yes, of course, because we're going to be talking about the People's Vaccine Inquiry, which, you know, is something I think that's really needed. We're breaking through to the mainstream now, all of this news about excess deaths and potential links to the vaccines. And of course, the UK COVID inquiry is just avoiding all of the questions around this. But before we dive into that, Liz, I wonder if you wouldn't mind, you're CEO of the UK Medical Freedom Alliance. I wonder if you wouldn't mind starting there, just telling us what that organisation is and what it does.
Yeah, okay. So I'm a former NHS doctor. I work in complementary medicine now, and I've always been passionate about medical ethics. So as COVID sort of unveiled, and over the summer of 2020, I was becoming absolutely horrified by the apparent abandonment of just basic medical ethics in the policies, the way people were being treated, you know, with all the different the aspects. But I could also see there was a real problem coming with the way the vaccines were starting to be spun, even in the summer of 2020, as they were going to be a solution. And I could see that there could possibly end up with some vaccine mandates. I just had a really bad feeling. And in the UK, we had no medical ethics, medical freedom campaigning organisation. So I thought, well, we needed to get our ducks in a row because this was going to be a massive battle ahead. And so in the autumn of 2020, I managed to co-found the UK Medical Freedom Alliance. And basically, our aim and objective is to challenge and lobby against unethical policies relating to medicine. So at the time, it was basically masks, the testing, and obviously the vaccine rollout, and then the mandates. And we have been lobbying government, regulators, policymakers, healthcare professionals, royal colleges, anyone who will listen. We've written over 60 open letters over the last 4 years, all fully referenced, showing them what evidence there was that what was being pursued was not safe, and also why it was not ethical. And I think we've created a really good paper trail of accountability, because all those letters exist. They were all published on our website, and you can see who was told what, when, and what evidence was available easily in the public domain at that time.
Now, Liz, I know that, you know, you don't do what you're doing for money or for fame or anything like that. You are a good doctor. There are good doctors out there. How does it make you feel watching what happened across 2020, 2021, 2022? As a doctor who went into it for the right reasons, how does that make you feel watching what has happened?
I mean, even in the first lockdown, when I knew somebody who had quite severe COVID, who was elderly, but who was not able to be visited by their GP, whose family wouldn't visit them, and who was getting sicker and sicker, and who was told just to stay at home. And I was appalled, because I was like, when did doctors ever not treat patients? When did they ever, you know, sort of put fear for their own health above, you know, their duty to care for a patient? And then he was finally admitted to hospital. He was there for 16 days, put on a ventilator, and died. His wife never saw him again. She was never allowed to say goodbye. She was never allowed to visit his body. And they'd been married for 50 years. And at that point, I was like, what is going on? This is just wrong on so many levels. That should never, ever have been allowed to happen.
Yeah, it shouldn't, should it? I mean, the reality is COVID, and we knew at the time, and this is what really riled me and got me motivated, was the fact that we knew at the time that the survival rate for COVID was 99.98%. And we knew that the majority of the people that were at risk, we knew who they were. And, you know, we had the Great Barrington Declaration, and it was all just ignored, wasn't it? The policies had already been decided regardless of the evidence, and we were told follow the science when it was anything but that. Liz, tell us about this really important new project you're working on, the People's Vaccine Inquiry.
Okay, so this was an initiative we launched yesterday. We've got a website, peoplesvaccineinquiry.co.uk. And it stemmed from an idea in January this year. So several of us had been asked by the inquiry solicitors to submit witness statements because we'd applied to be core participants in the vaccine module because we, you know, various groups, the Heart Group, Ros Jones's COVID children's vaccine group, Perseus, and UK Medical Freedom Alliance, we'd all separately and independently made applications to be core participants because we all felt we had a really important perspective. We'd worked very hard, produced a lot of evidence, and we wanted to give the other side. Baroness Hallett had not decided not to give us the core participant status, but had asked us to submit witness statements. And we were asked in early November, and I spent 2 months basically working really hard, produced a 50-page fully referenced document. It was a lot of hard work with Christmas in the middle. Finally submitted it pretty much at the same time as they postponed the module. It was meant to be in July this year, and it was postponed at that point indefinitely, but till at least 2025. And I spoke to the others and said, well, this is outrageous. We've got this amazing evidence here that needs to be seen by the public. We can't just let that just kind of, you know, be hidden away for the next year or more. And I'd also learned from the solicitors that they weren't guaranteeing our witness statements would even ever be published on the website, because apparently they can choose which witness statements to publish and which not to, and which to show to the core participants and which not to show. So it felt like we'd put a huge amount of work in for it never to see the light of day. So I said, well, why don't we put together our own inquiry, just focusing on the vaccine, and just get all of our different perspectives, our different areas of expertise into one central place for the public and the medical profession to see. So because this is a matter of, you know, if this is causing harm and is contributing to the excess deaths, you know, the longer this rollout goes on, the more people that take the vaccine, the more injured people and the more suffering that we're going to cause. So we want, you know, from an ethical perspective, I believe passionately in informed consent, which means understanding the full risks as well as the benefits. So we sort of had this idea, and over the last 4 months we worked really hard. We put together new witness statements because we weren't allowed to publish the ones we gave to the inquiry, so we've kind of rewritten them. And we also have recorded 20-minute video testimonies with slides, you know, which gives a brief summary of what's in the very long documents. Mine's 55 pages. I think Claire's is a lot more. And there's 7 of us, and we've got, you know, looking at the efficacy, the safety, the regulatory, the MHRA regulatory processes, the trial processes and sort of failures, the messaging and the nudging. Patrick Fagan covers that. And then I look at the sort of big ethical overview as to all the different areas where medical ethics and research ethics were just completely discarded.
Yeah, and it is absolutely criminal that this hasn't gone ahead as planned. I mean, you know, it is the biggest, as far as I can see, upheaval we've had to the social fabric of the UK, to our economy, to the kids' education, all of that since the Second World War. And we know it's political as well. I mean, I had Dr. Aseem Malhotra on the show 2 months ago, and he had sat down with 2 senior politicians from the Conservative Party, both former secretaries of state. And they basically said, and it was about the time that they'd said they were going to postpone this segment of the inquiry, the UK COVID inquiry, and they told him the government will not allow this to happen before the election because it will collapse the government. So it's all political. I think it's an absolute crime. If you think about all the priorities of the UK, this should be number one because it's had such an impact on every aspect of our society. Right, so Liz, we have got the UK COVID inquiry, and as we said, I think it's a crime that they have postponed this part of the inquiry until after the general election. I think that's a mistake. It's politically motivated. But we're told there is going to be this segment looking at the vaccine rollout. So why not wait until then? Why is it important that you're doing what you're doing now?
Well, I think, so the COVID inquiry seems to not to ask the right questions. So we need to be asking, should we have done what we did at all? And I would argue, especially when it comes to the vaccines, from an ethical perspective, it doesn't matter if it had turned out that they were safe and effective. The safety profile is almost irrelevant. The way we did it was completely unethical. It was reckless. There was no account of the precautionary principle. We basically rolled out something that had only been tested for 2 months. We had no long-term safety data. We had no reassurance that there was not going to be, in 5 years' time, some terrible effect on health or fertility or something really catastrophic that you couldn't unroll. And we didn't just roll it out to the people who really stood to benefit, i.e. the people who were most at risk from COVID, but we rolled it out to the whole population. And you just think, if you'd asked people 10 years ago a sort of multiple choice question, you're in this scenario and these are the people really high risk and these people have no risk, and you have a brand new technology that's working on genes and we don't have any data, who would you give it to? Would it be this group, or all of the above? Nobody in their right mind. You don't need to be a doctor to actually say that it was acceptable or sensible or, ethical to give it to everybody. And, we were giving it to pregnant women. We were giving it to children. And I just feel like what happened there? And I feel like we've just had the preliminary hearings for Module 4 where they discussed the scope. They've already said they won't be looking at the efficacy, because it's so apparent. These vaccines just are poor products. I mean, they don't do what vaccines are meant to do, which you would expect that the vast majority of people who got a good vaccine would never, ever get the illness. But we know that's not the case. Most people who are vaccinated get it multiple times. So these don't work. And they're not going to look at the specific safety of specific vaccines. They can't look in detail. So they're looking at the kind of the process around safety and sort of broad brush safety, but they've said already they can't, it's beyond the scope of the inquiry to ascertain whether vaccines are safe. So they're not asking the right questions.
Yeah, exactly. What do you think the consequences are, Liz? Because look, the government is trying its best. It has been to control the narrative, to say, they've stopped saying safe and effective now, but I think, long overdue. But they're still kind of trying to give the impression that everything's fine. I mean, you can buy the COVID vaccines at Boots now. That was a recent move. What do you think the consequences are for the general public, though? Because they know something's up. Most people now know either, even at a minimum, that they don't work. I mean, everyone had an experience of that who took the vaccine. They got COVID anyway. What do you think the consequences are long-term for trust in our medical establishment, in doctors, and in the health system?
I think we see different effects on different people. I think there are still people who keep going for their boosters, who are on their 7th, 8th, possibly even 9th jab. And I think they've almost kind of put all their eggs in one basket and they cannot look back now. So they are never going to be convinced by any of this because, they were obviously so affected by the fear that this was the only solution. I think there's a lot of people who are in denial, who aren't continuing to have the jabs, but just don't want to actually acknowledge that they gave over their sort of bodily autonomy, that they were coerced into something, that they did they kind of sold their body for something cheap like a holiday, and they said the government had the right to insist on a medical intervention in order to access basic freedoms for some people, like the care home mandates for the care workers, or for traveling for a lot of people. So I think people are definitely in denial, and then you've got the people like us who've known all the time, and I think there are people coming over to our perspective, but the more we can talk about it and give good reasoned arguments and actually try to connect people back to what's right and wrong, I think that's what it is going to come down to.
And something you've said that's really important there are still a lot of people in denial, but they kind of know something's up. Like I said, at a minimum, they know the vaccines didn't work because they got COVID, and everybody they knew got COVID. When I speak to people I know in their workplaces, they seem to be getting COVID more than people who didn't get vaccinated. So they know something up. What would you like to say if you had to speak to somebody directly who you thought was worried about the fact they've taken, because that's the thing which is driving, I think, the denial, is because it's like, gosh, if I admit what I think might be true, then I've got to admit, God knows, well, what have I done to my health? Has it damaged me? What would you say to those people?
Well, I would say the truth is what sets you free, actually. So there is nothing to fear from the truth. And actually knowing that there might be a problem empowers you to go away and actually do something about it. And I think, there's a lot of functional medicine, integrative medicine doctors now really working hard to try to help people to, detox from these vaccines, or just build up their own health and their immunity and do everything they can to be as healthy as possible to minimize, the risk of long-term effects. And I think, and also to say it's not your fault, you were under an intense psychological, warfare, that you were being, subjected to such obscene levels of propaganda and fear-mongering and coercion that actually, and this was professionally done by behavioral psychologists deliberately to nudge you into making decisions that were against your best interest. So in that sense, you were a victim. But the moment you become empowered and say no more, and then try to do the best you can to build your health up, our bodies are amazing, and we have more healing and recuperative powers than perhaps we are led to believe by the kind of mainstream. And I think we have to have faith and confidence in that.
Yeah, and I think that's really important. So, if you're worried, you seek the truth, it will set you free. But also, I don't think people should feel stupid or naive or, because it's like the Matrix. It literally is like the Matrix. It's everywhere. It's on your radio. It's when you go down to your doctor's clinic. It's on the TV constantly, the death counts every day. It's in the newspapers. Your employers are saying, you really need to. So, it's no surprise people were duped by all of this. Liz, we have run out of time now. So quickly, how do people support the inquiry? Is there any way that they can support it financially? And obviously they can share the content and whatever. How do people support it?
Well, what we're actually putting out a call to action to the public. We've got a template letter which they can just personalise and print off and drop into their GP. We want to get the medical profession aware of this amazing sort of like wealth of evidence that we've put on this site. We want people to start talking to their doctors to share this information. And then there's a Hope Accord that's about to come out for doctors and healthcare professionals and the public to sign. So all of those things, there's lots of calls for action, and follow us on Twitter, which is at PVI_2024.
And do you have a website that people can go to?
Yeah, it's peoplesvaccineinquiry.co.uk, and everything will be on there, including all the calls to action.
Fantastic. Well, listen, Liz, I'm really excited about what you're doing. I think that's a great idea, by the way. I will certainly be printing off a letter and taking it to my doctor, because there are so many doctors that still, I just think, they're unaware of the depth and scope of the evidence out there. Thank you so much for coming on the Freeman Report. And Liz, like I said, I didn't realise you hadn't been on, but you do need to come back again soon to tell us how things are going. Dr. Liz Evans, ladies and gentlemen, thank you very much, Liz.
Thanks very much. Thanks for having me on.